Hi, everyone, and welcome to our panel on mental health and disability. My name is Brenda Agnew, and I'm so happy that we are covering this topic. Obviously, wishing that we could have been doing this in person. I think it would have been a great source of back and forth dialogue with the people participating. But I'm just grateful that we're able to cover off on this topic this year. It comes up every year in our discussions, and it's such a prevalent issue that affects so many people, especially in the disability world. So very grateful to be here. I'm here alongside with April Hepler and Heather Hancock, and we are going to talk to you a little bit today about our individual stories, our experiences from different perspectives, some of the things that we've done to try to cope through some of the mental health challenges that we may have experienced. And hopefully provide some takeaways for other parents, people with lived experience, caregivers, and clinicians who may be joining us today. So I have the pleasure of starting. So I'll do a little bit of introduction on myself. So again, my name is Brenda Agnew. I am coming to you with the perspective of a caregiver. I have two boys, two teens now, and my younger son, McLean, has cerebral palsy. And he was diagnosed at about a year old. He's a surviving twin. He was born at 29 weeks. He spent 3 months in the NICU, and about a year of age, he was diagnosed with cerebral palsy as a result of untreated jaundice, which is a condition known as kernicterus. And the reason I mention that is that that becomes a really important part of my journey through some mental health challenges. And so, from my journey, it started almost immediately, as you can imagine. And I had postpartum with my first son, and that was easily diagnosed and treated, thankfully. And I went on to have a great experience with him. And then, got pregnant with twins. And unfortunately, at 29 weeks, we realized that there was something that had happened in utero. One of my boys had passed away. And so we had to deliver McLean to save his life. So, you can imagine what that was like for anyone that would be going through that type of grief and trauma. Had a 20-month-old at home and just going through the uncertainty of, a period in the NICU. And I remember calling my primary care physician during this time, completely unrelated. I actually called her to say, could I schedule my follow-up with her, my 6-week follow-up with her, because the thought of going into the OBGYN office was just too much for me. So I called her to make that appointment, and she knew what was going on. And she said, how are you doing? Do you need anything? Do you need any medication? How are you sleeping? How are you, and I hadn't thought about it because I was so focused on McLean in the hospital. I was so focused on my 20-month-old at home. And so I said, yeah, I do. Actually, I was having panic attacks and, everything that came along with what was happening. And so she recognized that very early and, reached out to make sure that I had what I needed. And thankfully she did, because that became that medication, if you will, that became a real saving grace for me during that time. And then, we leave the NICU, things seem fairly stable. I think, okay, maybe we've gotten through the worst of this. And then McLean was diagnosed with a severe to profound hearing loss when he was a few months old. We were not expecting that diagnosis. I felt it right away. I'm sitting in the office. I can see the spots before my eyes. I can feel, the pricks on my arms, the heat coming up my back. And I think, okay, I can feel that I'm kind of going into shock a little bit. And then that was followed up not too long after with his diagnosis of cerebral palsy. And, again, I say that that's a lot for anyone to handle. And what became more challenging for me on top of that is that because McLean's cerebral palsy was 100% preventable, you also deal with, I think, the magnitude of that thought that, this happened at the hands of someone else. And so that was a lot to deal with. And so I spent a number of years, the first few years with him were a complete whirlwind. As anybody can imagine, if you've been in that, if you either live with a disability or you've raised somebody with a disability, that first couple of years is a mirage of appointments and therapies and diagnoses and uncertainties and worries. And I felt like, one thing would just pile on to the other thing. And then, we would get through it and, I call the first 2 years the Bermuda Triangle. That's the best way I have to describe it. I got lost in it and I didn't think I'd ever find my way out of it. It was this black void. But I came through it, and I hear that that's fairly common the first couple of years after diagnoses. So we come through it, but then you're constantly being hit with things. So all of a sudden now it's, the first wheelchair appointment. It's a surgery for cochlear implants. It's starting school. It's all of these pieces along the way that can be exciting, but with them, they obviously bring a lot of emotion and, again, a lot of uncertainty, a lot of worry. And I'm rambling here because this is the best way for me to sort of get it all out. But, guys, feel free if I say something you want to jump in, but don't feel you have to. And so I felt like it always piled up on me. And I should also say that at the same time, I also went back to work after I had McLean. So at a year old, when he was a year old, I went back to work, 50 hours a week, operational job, and I loved working and I liked being a part of that. And that was really important to me. But at some point, it really did come to a head. And when he was, maybe 2 or 3 years old, maybe 3 years old, that was it for me. And I couldn't actually handle it anymore. And sadly, I did go to my employer and ask for a little bit of a break. And I was met with a lot of resistance. Mental health, as we know, is not understood. It's often explained away in different ways. I think their thought on this was she just wants time off to take her son to appointments, which was the last thing that I actually wanted to do. And no one was recognizing the mental health struggles that I was having. And I ended up being in crisis, and I did end up in the hospital. And so that started a whole series of events, which ultimately I landed on long-term disability for 7 years. Because I just could not get a grasp I could not function at a level that allowed me to be able to consistently manage my mental health, get the care I needed, and then also work and all of that. And that's a really tough place to be in. I felt like it affected my self-worth. It made me question a lot of things. But the reason I say that is I feel like that challenge didn't need to be that challenge. I've always looked back and thought, if my employer had I'm happy where I am today. I have a great job. It's led me down a path that I'm really fortunate for. But if my employer had given me that 2 weeks off, I wonder what it would have been like. If I had that time to take a breath, do what I needed to do, would that have made a difference in my journey? I don't know. Would I have ended up where I was? I don't know. But again, the reason I say that is I got to a point where I was in crisis, and that shouldn't happen, in my opinion. And I looked back again along the way, and I still struggle, and I should identify with, I've been diagnosed with depression, anxiety, that I still deal with to this day. And they manifest themselves in different ways. I have, thankfully, it's under control with medication. And I do have some other coping mechanisms. I feel like I've tried them all the last 14 years. But, it's really difficult as a caregiver to take care of yourself, shower, eat, let alone worry about your mental health. And I had, for so many years, people saying to me, you're just sad because of McLean and it's normal. And it's, I couldn't separate my mental health and the challenges I was having just from sort of everyday life. And I needed to do that. And so anyways, thankfully I'm in a place now, but it took a lot of navigating. It took a lot of advocating. It took a lot of explaining and a lack of understanding out there from people. And when I look back and I think, and Heather and I talked about this a little bit, and I think April and I talked about it a little bit as well when we were doing our pre-conversations, was what I really feel would have made a difference is when that diagnosis was handed to me, I would love to have had something alongside that that said, you're possibly, most likely going to need some assistance at some point to talk to somebody. And if I take it back a little bit further than that, that should have happened in the NICU. Yeah. You know, I mean, a social worker, I think, came in the first week. Are you okay? Well, yeah. And, you know, on the outside, you know, yeah. But on the outside, my husband and I function very well. People actually forget that we have a child with a disability sometimes, because we do. We function and we go over and above, and you know, I'm a type A personality. But, you know, I think there has to be a system of checks. When mom says, you know, yeah, I'm okay that first week, there's 3 more months that mom is there and a lot of things have happened, or dad is there, whoever that is. There was no system of checks and balances for the parent at that point. And then he's given this life-changing diagnosis. And I talk about this all the time. For anyone that's received a diagnosis of their own health, there is your life before and there is your life after, and they will never be the same. And so you hand this parent this diagnosis for their, you know, 1-year-old or 2-year-old that they have in their arms, and it's a devastating diagnosis sometimes, well, all the time, but sometimes more than others. And then you're given a pamphlet, and here you go, and this is what cerebral palsy means, and off you go. And that's not to the ill will of those providers. Their job is not to take care of me, right? Their job is to deliver a diagnosis and be a developmental pediatrician or neurologist for my child. But when I look at the cohesiveness of that relationship, when I look at, I'm his voice, I'm his advocate, I'm his person, you know, we need to be making sure we're taking care of the entire unit. And, you know, we always say happy wife, happy life. I feel like happy parent, happy doctor, you know, happy child. And I wonder sometimes about some of the adverse relationships that I had during this journey, and how many of those were just because I was so in a dark, angry, upset, confused, and worried space. And if I had have been in a better place mentally, I think interactions would have been better. I think advocacy would have been smoother. I think some of the things would have been a little bit easier for everybody involved. You know, school, everybody involved. And people, and April, you and Heather will talk about this as well. And April, you probably will talk about it a bit from a system perspective, but the unfortunate piece, and mental health is not alone in this, but when you're diagnosed, you know, when you're diagnosed with other health conditions, and I'm just going to say cancer or diabetes or things like, there's an immediate, right? Okay, cancer diagnosis, we're going to get, you know, the oncologist, and then diabetes. There's a mental health is different. There's a we're not, and there's this sort of, you know, and then when you finally do recognize you need it, the systems and the processes are not easily or readily available to access. And now you're down a rabbit hole of trying to get help, trying to get someone to listen to you, trying to get assistance. And so, you know, that I often think about, I do a lot of work when I speak to clinicians and physicians about delivering a diagnosis and the difference that you can make when you give that news in general. And what an impact that can have on the trajectory of how these parents view the future, right? So if it's given with, I'm really sorry, this is horrible, that, you know, or, you know, this is difficult for me to tell you, this is what but here's some resources, that's going to set I feel like the same thing is true for the caregivers in that situation. If we can set them off on a supported path with resources available to them, whether they need them or not everybody's ready, but just having the conversation, having that check-in, when you check in every year with your developmental pediatrician, hey mom, how are you doing? How's dad doing? You know, how is your son doing? We know the impact of things like this on siblings. My older son deals with a lot of it. I said, where does his anxiety come from? He worries about things I can't Well, where do we think it came from? Because all he's heard for 14 years is what if, oh no, what? He's had a lot of that in his life, right? Because he's seen it and it's hard to protect him from that. And so what's the impact been on him? And so my takeaway from that is I have a few things to say. If you're a caregiver and you've been given a diagnosis for your child, don't wait, don't hesitate, have something in place, because even if you don't need it, you have it there. Never be afraid to ask for help, ever, 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 ever. Make that a priority. Talk to someone. If you don't have the strength to do it, have someone to help you with that. And to all of the clinicians that work with our kids, check in on how mom and dad are doing. Check in on how the caregivers are doing, because chances are they're not doing that great. And they're trying to put on a brave face for you, and they're trying to be everything to everybody, and they're probably failing at times miserably. And what can you be doing to make sure that their mental health is in check? And what resource can you be to them? Those are lessons learned, and I would do things a little differently had I known now what I know then, but isn't that the way the saying goes? But I hope someone takes that away from here. And so that's my perspective. I know it's different than someone who's living with cerebral palsy. It's a different perspective as a caregiver, because people also think, you're just a parent, and it's so much more than that. And that's, I would think, what makes it such a challenge. But that's me. So Heather, love to hear you. Heather and I had a great conversation again in the pre-planning, and I could have talked to her forever about this. And the nuggets of wisdom that, she explained to me were so valuable, and I've been thinking about them for my son ever since. But Heather, love to hear from your perspective and your experience.
Well, thanks for sharing from the caregiver perspective, Brenda, because that's a huge component that's just never addressed. I'm coming at this discussion from the lived experience side, having been born at 25 weeks gestation, before NICUs ever existed. So I was placed in an incubator, and my parents were told that I would die within 24 hours.
Oh,
there was nothing back then. There was no intubation. They didn't have the equipment. Miraculously, I was breathing on my own. I was never ventilated.
Wow, at 25 weeks.
At 25 weeks.
You're a superstar.
There's just no explanation for it. So other than God had a different plan. So I went from there, spent 3 months in the hospital. My parents were not allowed to touch me, not allowed to hold me, not allowed to come anywhere near me until they could take me home. It was a different world then.
Yeah.
My brother was born 13 months later.
Wow.
And he was born a month early, but he was fine. So fast forward to he's starting to walk, or to try to walk, and I start to mimic him. Well, now there's a problem, because I keep falling over my own feet, and my hands are flying up in the air, and I'm doing these face plants on the floor. And my parents are looking at each other going, I think we have a problem. So to the doctor we go, and at 2 years of age, I'm diagnosed with spastic diplegia cerebral palsy. And at that time, it was believed that all children with CP were retarded, was the vernacular of the day. And it was also common in that day and time that all disabled children were put into institutions because they would never amount to anything. So my parents were told to do that. They refused. Then the search went for them, talking about caregivers, right? To find a doctor who would listen. Right. So they found a pediatrician at Alberta Children's Hospital, because I'm in Canada. And first thing he did when I was 3 was send me to the University of Calgary for an IQ test. And I had the IQ of a 5-year-old at the age of 3. So when that came back, I have to say I don't remember it at all. When that came back, he was like, okay, her disability is purely physical. So then the fight was on to get me into public school, because at that time, all handicapped children were put into special needs schools, out of the public eye and out of the public. And my dad was having none of that. So I was the first child mainstreamed into the Calgary school system.
Wow.
Yeah, good for my education, bad for my social life. So I was also, of course, going through all the normal in the CP world. Achilles tendon surgeries, therapy from the age of 2 onwards. I was used to being around children with various disabilities in hospitals, in therapy rooms, whatever. And I didn't really realize that I was different until I started school.
Right.
And the other kids who were able-bodied didn't accept me at all. So I endured intense bullying from kindergarten through to grade 12. Kindergarten, it started with parents calling my parents saying Johnny can't play with Heather because he might catch something.
Oh my gosh.
And then grade 1, grade 5 boys used to follow me home because we walked to school and push me down and kick me black and blue day in and day out. So
Oh, Heather.
those were the kind of things. Girls would pretend to be my friends until I trusted them, and then they beat me after school one day and beat me up and laugh. And that was pretty much the norm. That teachers were here, neither here nor there. They had their challenges with trying to deal with a person with physical disabilities who had no mental problems. So I learned early on that I couldn't fight back physically because I fell really easily and stuff like that. So if you tried to retaliate, it didn't go well. So I decided I would beat them by getting better grades. So, so I did that. So yeah, as a child, I think the main issues mental health wise are the first realization that you're different and that you're not going to be able to do the things the other kids can do without even thinking about. Then there's, the bullying, if that comes in. I know there's been measures taken to try to limit that, but I know it still goes on. Self-esteem takes a huge hit. Your body image takes a huge hit. You start comparing, and then you fall miserably short. Then you start asking your parents why, which can't be easy for them. But as a child, you're just trying to understand the paradigm that you're finding yourself in.
Yeah.
And again, there was nothing offered, no access to mental health services, no play therapy, no nothing. You just had to deal. Suck it up, buttercup, and get on with life. And I remember my dad saying that to me, you have to be stronger inside than they are. And that was basically what I did. Teen years, then you've got hormones kicking in. News flash, people with CP have the same emotions as everybody else.
Right. Yeah.
The teen years are exactly the same for us as they are for everybody else.
Yeah.
And then growth spurts cause problems for us with our spasticity.
Right.
I ended up having unnecessary orthopedic surgery because a surgeon told my parents he could put my kneecaps where they should be. So from 13 to 18, he tried and failed. Just going back through my notes here. So there's no supports or treatment as you're a teenager either. Again, body image is huge, especially because your hormones are raging. Male or female, you know, you're watching peers have their first boyfriends, girlfriends, whatever. But the adult world still treats you like a child, and your peers just laugh at you. Or, I mean, I even had people pretend to take interest and then just use me as the butt of a mocking joke at the end of it, in front of the rest of the school. So it takes a huge toll mentally. I mean, by 14, I was suicidal. There was other abuse going on in my life. So there was no safe place for me. School wasn't safe. Home wasn't safe. Nobody was safe. So yeah, at 14, I was suicidal. And for me, what happened was God literally saved me. So he ran to me and saved me through a circumstance that's nothing short of miraculous, but it's not really part of this, but my faith is part of this. So that's why I mention it. Because my faith became my anchor. And it was the way my mental processing went. I went from complete hopelessness and despair. Nobody loves me, and my parents only love me because they have to the God of the universe loves me. And if the God of the universe loves me, then to heck with what anybody else thinks or says. And I just went from there. So during that time, I've also taken up writing again. I've always loved writing, but I never took it seriously. Well, now I'm taking it seriously. So I write short stories, poetry. I have them published online. My first novel's done and in the editing process. So again, you just hit the ground and figure out how else to be productive.
So Heather, what would be your, I'm just, I'm cognizant of time, and I definitely want to make sure that we hear from April. She has a lot to say, but I don't want to cut you off because your story is so important, and you've talked about that lifespan piece. But what would be, sort of your takeaway words for either a person with a lived experience or a clinician that is working with people with a disability when it comes to mental health?
For other adults with CP, you have to be your own advocate. If you're unable to be your own advocate, then reach out to one of your local CP chapter and ask for one, because you can't do it alone. For the medical community, you need to educate yourselves. This goes beyond childhood. And we are your educators, so listen to us. Stop with the attitude that you're a medical professional and we know nothing. We can tell you more about CP than you can ever learn in a lifetime, so listen to us. If we're telling you we're in pain, it means we're in extreme pain because we have a very high pain tolerance. Don't disregard that and tell us we just have to live with it. If I hear that one more time, I'm gonna throw something at them, I think, and then it wouldn't be good. Anyway, and give us some options here. Don't just, shunt us away and say, well, it is what it is. Learn to live with it. No, it isn't what it is. We need to have strategies and components. Research is now being done on adults with CP. That's only started within the last 5 years. I am an intense advocate for that, working with CP Research News. I know it won't help my generation, but it's going to help the ones behind me. I don't want anybody living through this the way I have. I don't want anybody having to fight the way I've had to fight. Yeah, I'll just stop.
Thanks, Heather. Thank you so much. Okay, April, I can't wait to hear your perspective and your experiences. You know, we've heard now from two people that are in a, you know, from a caregiver perspective and a lived experience, but you know, the element that you bring is so important, because you're the one that's there to help people through this journey. So go ahead.
All right. Well, thank you so much. I was just so thrilled to be able to be part of this conversation today. So I am the founder and executive director of Adagio House, which is a nonprofit counseling agency in Virginia in the United States. And the reason we exist for people who have disabilities and for caregivers. And the reason for that is because of my own, because of my own personal journey. I have a child with Fragile X syndrome and autism. And the first night in the hospital, I knew something was going on, and not a soul believed me. It took 6 months before our pediatrician gave a diagnosis, and it was the first of many. It took us a decade to really figure out what was going on. And that time for me was intensely lonely, and intensely difficult on many different levels. We don't need to go into that, but that's why Adagio House exists, is because I have lived through so much of this. As a carrier, a premutation carrier of Fragile X syndrome, I have the potential for developing my own disabilities later in life. And so I'm trying to do a lot of preventive care and that sort of thing as well. But right now, as we're in the middle of not only the challenges of life that come with disabilities and with caregiving, we also have this pandemic, right? That is just beyond words. It has increased anxiety and depression tenfold, if not more. And we're seeing just this tidal wave, this tsunami of isolation and increased need for mental health support. Already, as caregivers and people with disabilities, we can feel isolated, right? Because so many people don't understand. Yeah. So many people look at us with judgment, thinking that as a caregiver, we're not doing what we should be doing, or our children would be behaving better. Or as a person with a disability, if we would just work harder, or, you know, could you just contain yourself, right? Like, there's so much judgment that causes that isolation in the first place. We don't want to talk about our story because people tend not to understand. And so we end up in this place that is magnified by the isolation of the pandemic. And I am a firm believer in John Bowlby's attachment theory. So back in the 1950s, following World War II, John Bowlby's this researcher in England, and he is looking at children who have been through the war, many of them orphaned, and he starts to see these patterns that are arising in these kids. So he starts to think about parent-child attachment. And at the time, Sigmund Freud was the big guy, right? Like, everything's about sexuality. And here comes Bowlby saying everything's about relationship.
Wow.
And people are like, you are crazy. That's not true. So Bowlby's research is just plowed under for decades. And it's not until the 90s that his research starts to get a little bit of recognition, and it's continuing on today. Anyway, there's amazing attachment research out there, but what it says is our first drive is the drive to connect, the drive to belong, the drive to be in relationship with one another. The Gottman Institute, John and Julie Gottman, they say it's something like 90% or more than 90% of what we do, everything from our facial expressions, our body language, our tone of voice, everything we do is a bid for connection with the people around us. And so here we are, this isolation just magnifies our mental health issues. And so I think about these things and I think, what do we watch for, right? What do we need to pay attention to know I need more help, right? I need somebody to sit with me. So if you're thinking about your own life or the life of people you love, when a therapist is going to be evaluating somebody, we're going to look for several different things. Changes are things to notice, right? So change in eating, change in sleeping, change in mood, change in activities that we participate in, change in speech patterns, change in personal hygiene. Yeah. These changes can indicate to us that something is going on and this person may need extra help. So if it's someone who usually is really well put together and they present themselves great, and I'm sitting up straight and tall because I'm not that person. But if they're normally, like they've got this perfect makeup and they look great all the time, and suddenly they're coming in and you're seeing them all disheveled and looking kind of rough, check in. And then if someone's gaining a lot of weight or losing a lot of weight, if you notice that they're talking in this really rapid, pressured speech, and they're usually pretty laid back, chill, check in, right? There's all these things. And if you are experiencing these things yourself, if you're having a hard time falling asleep at night, staying asleep, or getting up in the morning when it's time to get up, notice that. Right. And really, I think a big thing about our lives is accepting reality, noticing what's really happening and saying, oh, look, I really do need help, and it's okay to need help. It is really more than okay, because again, we are built for connection. We are wired for that receiving, that giving and receiving of help. We're wired to be in this together. So what you can do, if you notice that there's some changes happening in yourself, if you notice that there's changes happening for your loved one, there's several things. Finding a good therapist is really important, and I do stress the word good. So by good, I mean someone who you feel hears and understands you, who accepts you without judgment, who is able to sit with you in the dark places and not try to push you out of them, right? Like it's okay to not be okay. And a good therapist also is not going to promise that everything's going to get better. Right. We live in a world that isn't perfect, and it's never going to be. And so what I say to people all the time is, my goal is not that you're going to leave this place and just be great. My goal is that you're going to learn how to thrive in the middle of what you're experiencing. Yeah. We can do hard things. We can face them. And it's all about the internal world. Yeah. Heather, it is about what we have inside us. That we bring to all of our circumstances. So after finding a good therapist, taking care of our physical bodies, thinking about what our bodies need, whether that's some more vegetables or some more water, or moving in some way that makes your body feel good. That doesn't have to be going for a run. I don't go for a run. It can just be gentle movement, stretching, whatever can help your body feel good. And trying to find time to bathe regularly. And I know that sounds really silly, but we can feel so much better just by getting our bodies clean and smelling nice. Then to take care of your mind, to think about a practice of gratitude, whatever that might look like for you. And when I say that, I do not mean ignore the bad things. That will get us into even more problematic places. I mean to really think about what are the good things. Find things to be grateful for. We just have to look for them. And so developing some kind of practice, whether that's in a journal form or a spoken word form, whatever works for you.
Yeah.
I also really encourage people to notice their thoughts, to speak kind words to yourself, to offer yourself grace, to notice if you're beating yourself up, and to try to say, oh, look at me, I'm being so mean to myself. I'm going to take a breath and I'm going to offer myself a little grace here. And I'm going to try to say something more kind instead.
Right.
You can train your brain to savor good things when you really work at focusing on whatever those things that you've been grateful for, the kind words you've been saying to yourself. You can pause and you can really sit in that place. Whether it's a beautiful sunset that you just stop and you just look at for a while and you soak it in. We can train our brains to be wired better to hold on to the positive stuff. Our brains naturally are wired to hold on to the negative things because we want to stay alive. So if we remember all the bad things that happened, then we'll know how to avoid them in the future and we can live, right? But it does not do us a great service when we're trying not to be scared, anxious, depressed, right? So we need to learn how to really savor those good things and to reassure our brains that just because I've had a bad day does not mean it's the end of the world, right? So then taking care of your soul is the other thing I like to talk with people about. And that's a big thing for me. I always talk with people about spirituality, whatever that might look like for you. I think that we all are spiritual people. We have an element of our lives that needs to be nurtured, whether you call it soul or spirit, whatever perspective you come at it with. For many people, spending time in nature is a great way to nurture their spirituality. Others might develop a meditation or a prayer practice that can really benefit them. For some people, it's going to religious services and connecting with other people of faith, but to really nurture that spirituality in whatever form it is that you hold that to be. And a big part of that, and this one sometimes can feel hard for people, but I firmly believe that a really big part of that is forgiveness, not only for yourself,
Right,
but for others too. And forgiveness does not mean two things. It does not mean that there was not a problem. And it does not mean that you should be in relationship with that person. So forgiveness means that you are not going to harbor in yourself all the awful, ugly, negative things. You are going to let those things go for your own benefit.
right, right,
And to really offer yourself that freedom.
right.
So forgiving ourselves for the things that we wish we had done differently, forgiving other people for the things we wish they had done differently.
Yeah.
But I would hope that you are always in relationship with yourself. We have a lot of problems when we're not, right? But we don't always have to be in relationship with other people.
Right.
So I think we can allow ourselves to find places where we can give ourselves space while we offer forgiveness.
Yeah.
And then finally, it is relationships. We need to pay attention to who our people are. Who are those people? When you think about them, you just feel better. Just the very thought of them makes you feel more relaxed, makes you feel like it's going to be okay, right? Find your people, the people who are really there for you when you need them. And that's the whole question in attachment is, will you be there for me when I really need you? And if the answer to that question is yes, that's one of your people, right? And then also on the flip side, think about the people that really drain you, the people that you really have a hard time being around, and give yourself some space to create and respect boundaries that you put in place to protect your heart and to allow yourself to, I'm not saying you need to cut those people off. We all have difficult people and we can't cut them all off. But to give ourselves space, to guard our hearts, and to be able to really nurture those connections that are life-giving and can really build us up, and we can build each other up. So that's a really like crazy fast, like if you were in therapy with me for 9 months, we would dig into this stuff and we would, really go to it, right? But those are all the elements that I would say to really pay attention to. And if there are places in those different elements that you feel are really a struggle right now, that's another time to know maybe it's a good time to get some help.
So April, what's the best way, in your opinion, for someone to get that help? So to find, like, where can they go? Who should they talk to? What should be sort of that first place that they can access when they finally realize I need some help here?
Okay, so great places online. There's inclusivetherapists.org. They're a group of, so Adagio House, we have our profile up there. There are a group of therapists who intentionally want to be inclusive with everybody. So not depending on your ability, right? So that's a great place to go. You can look up your zip code and therapists in your zip code who are on that site. Psychology Today has a website as well. You can look at therapist profiles on there. So there's lots of places online. Even if you just Google therapist near me, there will be therapists that pop up. But I find that the best way to find a good therapist is to talk to people. Who do you see? Who do you love? And good therapists will be heard about, like their clients will say, oh, I cannot tell you how much I love so-and-so.
Right. Okay.
So that's the absolute best is that friend who goes to see somebody, and it's a clue. And a good therapist will also be all about fit. So if you go the first time and you just don't feel like it's quite the right thing, a really good therapist is going to say, I can give you names of 3 other people that I think might be a good fit for you. And no good therapist is going to expect you to come back and back and back if you do not feel like it's a good fit. I tell people all the time, I'm a great therapist, but I'm not a great therapist for everyone.
For sure. Okay. And it feels like this should be something too that, should be in the toolbox, perhaps of, the physicians that are working in this population, to have maybe some relationships with some therapists in the community, or to have, some of that info so that when parents are at an appointment, or, someone with disability is at an appointment with their neurologist or whatever that looks like, and they finally sort of say, I'm having these, these concerns, that they could say, here's a list of people you could perhaps reach out to. So I think that would be really, valuable as well.
Yes, I agree. I think that collaboration between medical doctors and psychotherapists is just crucial. And anytime we can develop those relationships, my favorite thing is to work on a team where we've got a really engaged medical doctor, a really engaged psychiatrist, and a really engaged psychotherapist.
Yes.
I'm like, we got this, right? Like it's the best thing. So I love anytime we can pool all the resources together and work as a team. It's just the best thing for everybody.
I love that. Yeah. And the more you're talking, and I'm just thinking about these examples. I mean, Heather talked a lot about surgery, and I'm thinking about these examples. You know, my son was in the hospital for 3 months in rehab for an ortho procedure. And, you know, again, you're away from friends and family, you're living in the hospital. At no point did anybody say, do you need to talk to someone? Should we, you know, my son was going through challenges, not with friends. And, you know, anyways, I think you're right. I mean, it should sort of be that. It'd be great if everybody had that, like you said, that relationship, that toolbox, that front of mind to sort of say, you know, because we develop these great relationships with some of these primary care physicians or ortho and our neurologists, and they become our go-to. And if they had these resources as well, that would be so important.
Yes,
yeah,
absolutely.
Amazing. Okay, well, thank you. I've taken up so much of your time, but I'm so very grateful. And I hope everybody benefits from the things we've talked about today. And we would just leave you with this is, you know, talk, find someone to listen. There's no shame whatsoever. We need to end the stigma. And if we can address our mental health challenges, I think the journey would just be a little bit easier right the way through. And, you know, let's really treat mental health the same way that we're treating ortho, neurology, GI, respirology, and all the rest of it, because it's, in my opinion, it's more important than anything. So, and it drives all the rest. So thank you so much, everyone. And I really appreciate it.
Thank you so much, Brenda. It's wonderful.
Bye. Okay, thanks, guys.
Hello, my name is Meredith Schauber, and I'm so grateful to be here speaking with you guys. I know that I can't see everyone that I'm speaking to today, but hopefully you'll benefit from what I have to say today, and it's just such an honor to be here. And before we get into the topic of mental health, I just want to tell you a little bit about myself, introduce myself to you. My name is Meredith, and I'm 24 years old. I'm from Grapevine, Texas. I was born and raised in Grapevine, Texas, and I'm a graduate of Abilene Christian University with my nursing degree. I graduated in May of 2020. I'm the youngest of 3 sisters. I have 10 cousins, all girls, so the holidays can get a little crazy sometimes, but very, very close to my family. I'm very, very grateful for them. So I'm currently working at a hospital in Arlington on a women's floor, and I'm a registered nurse, and I help babies who are a step down from the NICU unit, and I also help moms recover from labor and delivery after they deliver. And I also have my lactation certification. So I'm just very thankful for my job and to be where I am. I'm a former patient of Dr. Mauricio Delgado, and he is one of the reasons that I'm speaking to you today. He's on the board of the AACPDM, and I'm so thankful for him as well. I was born at 25.5 weeks, and I spent 80 days in the NICU after having a bleed in my brain at birth. Because of this, I battle a diagnosis of mild cerebral palsy and spastic dystonia, primarily affecting my right leg. Growing up, I experienced Botox injections, physical therapy, and when I was 8 years old, I had a bilateral osteotomy to twist out my feet. It was one of the hardest experiences I ever went through, but I wouldn't change it for the world because it developed faith in me. It was how I found the Lord, and it developed such a joy and strength and endurance in me. If you looked at me today, you would see that I walk with a mild limp, and I still experience some muscle tightness, but thankfully I made a full recovery after that procedure. Even though I was wheelchair bound for several months and use a walker, I'm so thankful to be where I am today and not have to use those things anymore. So related to the topic of mental health, there was a time in my life where I came to the complete end of myself. It was really, really challenging. It was during the years of junior high and high school. So growing up with a physical disability, it's really, really challenging in all stages of life, but especially these stages of life for me particularly. just because in these stages of life, you're searching to find your identity, and a lot of worth is placed on physical appearance. So these normal stages of life that are expected growing up were just magnified for me because I had a physical disability. So I spent a lot of time just comparing myself with other people and really just wanting to be out of my situation, having a physical disability. And I think that contributed a lot to my depression. I became really hopeless and sad and unmotivated, and didn't really know or understand why I was feeling this way. I tried to kind of come out of it on my own, but was unsuccessful and just felt really guilty for feeling this way. Typically, I'm a really positive person, and so I was really frustrated that I couldn't get these thoughts or these feelings to go away. And one day I had just kind of had enough and decided to open up to a teacher, a trusted teacher, after school one day. And I'm so glad that I did that because he responded just so graciously and compassionately. And that would be my first recommendation to anyone who's struggling, is just to really find someone to open up to, that you trust, that you can be open and vulnerable with. And it may take some time to find that person, but I encourage you to keep trying because there are people out there who will listen. Therapy played a huge role in my recovery, and I spent several years in therapy just talking through what was going on, and spent a couple years of my life on medication as well. So I would encourage people to just find someone that they can open up to and trust. I love my family, but it was very, very challenging to be open and honest with them because it was really hard for them to see me struggling with these feelings and these emotions. So I remember we were trying to find some way to navigate. How do we approach depression, and how do we approach these days when it's really, really difficult for me? How do we communicate with one another? And I have a memory of being that junior high and high school age, and we were in Colorado on a family trip. We were on vacation, and we were going on a hike, and it was beautiful, but it was really, really difficult, especially for me with my leg. And we were at a point in the hike where I just became in too much physical pain. And I looked at my parents and said, oh gosh, I cannot do this anymore. This is just too hard. I'm in too much pain. I can't do it. And they looked at me and they said, oh, we're so sorry that your leg is hurting. How can we help you? What would you like to do from here? And how can we get to the top of this hike together? And in that moment, I thought, oh my gosh, that's how I want to approach depression and mental health. This is how we need to approach it because it's just as real as the physical challenges in life, just as real as the physical pain that those who have a physical disability experience. So I remember thinking, that's it. That's how we need to approach it. We need to approach it with openness and honesty, saying, hey, I'm here and this is hurting and I'm not sure what to do. And then people need to respond by saying, oh my goodness, I'm so sorry that you're feeling this way. What would you like to do? Where can we go from here? And how can we make it through this together? So that was really a defining moment for me and my journey. Another huge recommendation that I would have, something that helped me through my challenging times, was my faith and finding something that was greater than myself. Also, I would just encourage you to find something that you're passionate about and invest in it wholeheartedly. Even though you might feel unmotivated and just really down, I found that finding that passion and just going for it really tends to help. In those junior high and high school years, I was really searching for my identity. And even though you don't find your identity in these things, I was trying to decide whether to go the sports route. And even though I'm not a professional soccer player and not very good at it, I was trying to decide whether to go the sports route or the creative arts direction. And I ended up deciding to go the creative arts direction and really found a love for writing and theater. And there are several songs and music that got me through some really difficult days. So whenever I would have a bad day, I would listen to that music and I would write about it. And that would really help pull me out of those really difficult emotions to navigate. And I would encourage you to find something similar, whatever it is for you. Another moment that really stands out to me when I was struggling with my mental health is when I went to one of my appointments with Dr. Delgado, actually at Scottish Rite Hospital. It was one of my routine appointments for my leg. And I remember I just opened up to him about what I was going through. And he looked me dead in the eye and said, "Meredith, we need you, we need you." And that meant so much to me. Not just because it was all about me and my life, but just because it was such a helpful reminder of, gosh, we have a unique and God-given purpose to steward that only we can complete. And people watching this might say, "Well, Meredith, I don't want to go in the medical field." And obviously you're a nurse and these challenges with your leg led you to the medical field. But I would say to you the same exact thing that he said to me. We need you so much. And your perspective is so, so valuable. Because even though you might not be going into the medical field, or you may not share your story directly about what you've been through physically, your perspective is so valuable, because there are people in this world who may not be crippled on the outside, but they're crippled on the inside. And they're really searching for hope and joy and peace and strength. And you can be that beacon of light for them. So I would just encourage you with the same words that he gave me. We need you here. And no one else can fulfill your purpose but you. You're uniquely created, beautifully created, exactly the way you are for a reason. And it took me quite a few years to be able to embrace that. And it's still definitely a journey, but I would just encourage you with those words as well. I think one of the lies that I believed when I was going through depression was that it would last forever. And I just want to encourage you sitting on the other side of this screen that there are joyful moments ahead, that there are brighter times ahead, and every day may not be easy, but definitely each day is able to be persevered through, and you just need to take it one day at a time. I think another thing that I really wrestled with as a person going through a physical disability, that I'm sure many of you wrestle with as well, is why. And I think trying to search for that answer of why contributed to my depression as well, because I was so hopeful in finding a cure, and just so hopeful in wondering, why did this have to happen to me? Why am I going through these physical challenges? Why am I so different than everyone else? And I still haven't fully discovered that answer yet. Definitely the medical field and coming full circle is a huge answer to that question. But I want to encourage you that I'm finding little answers to my whys every single day. This call being one of those. And it took me, again, a couple years to figure that out. And that's another thing, is this mental health journey does take time. And so I just want to encourage you that we can be patient together and we can pull through this together. So I would just encourage you today to just find something that's greater than yourself. My faith really, really helped me and is the #1 reason that I made it through some really, really difficult days. And then my second piece of advice, again, would just be to be open and honest with those around you, to find someone that you trust, and then to find something that you're passionate in and invest in it wholeheartedly. One more thing that I would just recommend to you is that your pain is working a purpose for you. And just like we stretch our muscles in physical therapy, or we do exercises to help ourselves physically, I believe it's the same thing with mental health. It's stretching us and it may be painful in the moment, but it's actually making us stronger. And I want you to just find comfort in that we need you. We need that perspective from you. Your pain is working a greater purpose in you. And so I would encourage you with those things, and that this will not last forever, that you're not alone. And I definitely don't have all the answers, don't have everything figured out. I'm still learning each and every day. It's a process and a journey, and I definitely still have difficult days that I experience. But I'm very, very thankful to God and to my family and to Dr. Delgado for the support that he gave me over the years. So anyone who's watching this who's struggling, I just want to encourage you that you're welcome to reach out to me if you would like to talk or have any questions or comments. I would be so, so happy and honored to talk with you. It's just a joy to be here today and share with you the joys and the hardships that CP brings. So thank you so much for your time, and thank you for listening, and just want to encourage you that we need you and there is purpose in your pain.